One of the things in the 20 years that I've worked at Rosecrance that has been probably one of the most challenging and difficult aspects of my role in admissions to our residential services has been historically the challenge that we've had in providing access to services for unfunded or public funded local clients. We know that Rosecrance has had a very long history of serving the Winnebago County area.
Good afternoon. My name is Craig Stallings, and I've had the opportunity to work at Rosecrance well over the past 26 years. Much of that time spent at our Harrison location. During that time, I've seen many of individuals who have made that decision, that tough decision, to seek treatment, and at times, unfortunately, to find out once they get to detox that there are no residential beds available, or that there's a long wait list for the beds. Uh, this is one of the harder things to deal with. As I said, when a person makes that decision for treatment, that's when we like to say you strike when the iron is hot, and need to be able to provide services. Um, with funding from the Winnebago County Mental Health Board, we were able to not only expand our beds, increase our beds, but to provide more access to services for our clients.
And the number of people that were able to get in much more quickly. You know, back in fiscal year 2022 and the early part of 2023, folks would be waiting weeks potentially to get into treatment for Medicaid opening to come in. Currently, we're able to accommodate anyone who is looking to get into our health center for withdrawal management, usually within a matter of a few days.
Just in the previous quarter, we were able to see almost double the number of clients that we saw in the previous 2 quarters. That is tremendous. I think that having that initial opportunity to not only receive detoxification services, but engage in residential services, that sets the stage for them to continue into outpatient individual therapy and lasting recovery.
So when we were given the opportunity by the Winnebago County Mental Health Board to increase our capacity through additional funding for those clients, it was a game changer in terms of the opportunity that it gave us to offer admissions to that population. And so just to give an example, just 2 short years ago, in 2022, we averaged, perhaps 20 to 25 admissions to our Harrison campus for adults for substance use disorder. After receiving the grant, we were able to raise that figure by 40%. That means that we have been able to almost double the number of folks that we serve, adults with substance use disorder, at our Harrison Avenue location. So it has meant a huge difference to the community in terms of the number of people that we can serve.
Well, with the Winnebago County Mental Health Board funding, this has assisted Rosecrance to increase our detox bed capacity from 12 to 24 beds and allow us to expand upon our residential beds, adult residential beds as well. Secondly, this funding helps relieve some of that financial burden that many of our clients experience if they have no funding or without insurance.
I'm very, very, very happy, very pleased with the impact that these dollars have given us in terms of the ability to serve more of the local population.